Page 1 of 243. Aacn Csc Review Course, Session 1 to 4 Study. Guide with complete 480 questions and well-elaborated answers just released this year. Which of the following is a characteristic of diastolic heart failure? A. Inability of the heart muscle to relax. B. Dilation of the ventricular chambers. C. Increased filling of the left ventricle. D. Decreased ability of the ventricle to contract. Correct. With diastolic heart failure, the left ventricle is unable to relax, leading to signs and symptoms of heart failure, but the patient maintains a preserved EF as the muscle retains its ability to contract. B. Incorrect. Dilation of the ventricular chambers is a characteristic of systolic heart failure. C. Incorrect. Diastolic heart failure is an abnormality with heart filling. The heart muscle does not relax normally, and the heart may fill too slowly or asynchronously. If the left ventricle does not relax properly or is thick and stiff, it does not fill in the usual manner and blood is drawn back into the left atrium and eventually into the lungs. D. Incorrect. Decreased ability of the ventricle to contract is a symptom of overextension of the heart muscle in patients with cardiomyopathy. Following a STEMI, the nurse auscultates a late systolic murmur at the apex. The nurse should suspect the finding is R/T, the new onset of A. 1/4. Page 2 of 243. A. Right bundle branch block. B. Left bundle branch block. C. Papillary muscle rupture. D. Calcifique plaque rupture. Incorrect. A RBBB would cause an electrical delay in conduction for a wide split S2. B. Incorrect. A LBBB would cause an electrical delay in ventricular conduction for a paroxysmal split S2. C. Correct. A papillary muscle cord rupture results from ischemia to the tissue supplying the mitral valve. A systolic murmur is heard due to mitral regurgitation. D. Incorrect. Plaque rupture would cause an occlusion of the coronary artery that would not directly cause a new systolic murmur. The nurse is reviewing the plan of care for a patient with systolic heart failure who has enalapril, Vasotec, furosemide, Lasix, metoprolol, Lopressor, and carvedilol, Coreg, ordered. Which of the following will provide the most accurate assessment of TE regimen? A. Daily weights. B. Strict INO. C. BMP every morning. D. Serial CXRYs. Answer OA. Correct. Assessing daily weights is a non-invasive and easy method to assess compliance with the effectiveness of a medical regimen in patients with heart failure. Observing the patient's ability to maintain a consistent weight indicates compliance as well as the effectiveness of the medical regimen. 2/4. Page 3 of 243. B. Incorrect. Strict INO is only one component of a plan of care, but does not assess if a patient adheres to the medical regimen or if the regimen is effective. C. Incorrect. A daily BMP would not help assess the effectiveness of the medical regimen as the majority of the panel components are not affected by the drugs listed. D. Incorrect. Serial CXRYs could reveal worsening heart failure, but assessing daily weights is far easier, non-invasive, and cost-effective. Which of the following patient situations might be best treated with the Mays procedure? A. Recurrent ventricular tachycardia refractory to cardioversion. B. Recurrent atrial fibrillation refractory to drug therapy. C. Cardiomyopathy with an EF 20%. D. Coronary artery restenosis following PCI. Answer heavy check mark A. Incorrect. Recurrent ventricular tachycardia refractory to cardioversion would be best treated with the insertion of an automatic implantable cardioverter defibrillator. Be correct. In a Mays procedure, numerous incisions are made on the left and right atrium so that scar tissue forms. This scar tissue does not conduct electricity, which disrupts the path of Abnormal electrical impulses. C. Incorrect. Cardiomyopathy with an EF 20% would be best treated with either inotropic or mechanical circulatory support. D. Incorrect. Coronary artery restenosis following PCI would be best treated with antiplatelet therapy. 3/4. Page 4 of 243. A patient develops chest pain, nausea, vomiting, and diaphoresis. The 12 lead EKG is normal. A. Further cardiac assessment is warranted, as it is common for ST segment elevation to be absent in A. An anterior wall MI, B. A posterior wall MI, C. A lateral wall MI, D. An inferior wall MI. Answer heavy check mark A. Incorrect. An anterior wall MI would have EKG changes in leads V1, V4. B. Correct. In a standard lead setup, the EKG typically does not look at the posterior wall. Because of the location of the occlusion, ECG changes would not be apparent. C. Incorrect. A lateral wall MI would present changes in leads I, AVL, V5, and V6. D. Incorrect. An inferior wall MI would present changes in leads 2, 3, AVF. While reviewing the 12 lead EKG, the nurse notes new changes with ST segment elevation in leads 1, AVL, and V2, V6, plus reciprocal changes in 3, AVF, and AVR. The nurse should realize that the area of infarct involved the A. Anterior and lateral walls, B. Posterior and inferior walls, C. Lateral and septal walls, D. Septal and posterior walls. Answer A. Correct. The ST segment elevation and reciprocal changes are indicative of occlusion of the left anterior descending and left circumflex arteries. These will affect the anterior and lateral walls. Powered by TCPDF, www.tcpdf.org/4.